us now is Congressman Bob Latta, and we're talking health care reform.
Absolutely.
This is going to be a hot topic all week and beyond, no doubt. And as a Republican, obviously you're very concerned about a plan that has huge Democrat overtones. What things, in your mind, have to be out of this bill before you could even consider voting for it?
Well, first of all, first and foremost, it's really breaking this bill apart. The American people say, wait a minute, we don't want a 2,700-page bill. You know, we want something that we can understand. We need to talk about, like, pre-existing conditions, to talk about tort reform so doctors don't have to practice defensive medicine. We want to be able to say, let's buy, be able to buy insurance across state lines that groups can pool. Now, there's 4 things right off the bat that the American people say, let's start from those 4 points. Don't have this massive government takeover, what they're trying to do right now, plus doing it in a process that, as we talked a little earlier, that our founding fathers are rolling in their graves because they never would have imagined that we'd have a piece of legislation that they're trying to deem through, maybe, which would mean that they won't even vote on it. They'll vote on a rule, but don't vote on this because we don't want to have to go home and tell our constituents that we voted for this mess.
Okay, well, what do you tell people, though, who are waiting and hoping for something better than what they're dealing with now? The people who've been denied because of pre-existing conditions, the people who've gone bankrupt because of medical bills. What do you say to those people?
Well, again, is this bill going to do it? Because, this started out, the president said he wanted a system that was going to be cheaper, no deficits, and insure everyone. Well, now we've gone from their own proposal from $46 million down to $30 million. The cost when it left the House was about $1.3 trillion without the doctor fix, which is over about $250 billion right on top of that. And now they're down to $30 million, but the cost is almost the same. So what they're doing is it's going to be a system, really, it's going to be rationing. It's going to be a system they're going to say, well, the government's going to say this is what you can get, this is what you can't get. And this is why we saw that one of the premiers in Canada who had to have heart surgery recently. Where do you have it? His doctor up there said, you better go to the States. And so he's going to have it done in Florida. So, we have the greatest health care system here in the world. Does it need fixed? Yeah, those 4 things right off the bat that I talked about earlier, we can do that. But what they're trying to do right now is take this thing over. They want to get it done before Easter. Why? Because they know if their members have to go home and face the American people say, absolutely not. And they are trying to circumvent the American people. They're trying to say, we're elitists. We know better than you. And Nancy Pelosi, Harry Reid, and Barack Obama have come up, they finally are going to emerge from their, dark, smoke-filled rooms. The president does smoke. And, they're going to come out of these rooms and then say, okay, here's what we got. And nobody's going to know it until right then.
Okay, very quickly. Can this be deconstructed down to the elements you say are necessary, or is there no hope of that?
No, I think the American people right now have got to call their members of Congress and the United States Senate, the United States House, and say absolutely not, don't vote for this piece of legislation. We'll do what the American people have said that they wanted to do, take it back, and now we're going to do what? We're going to do it in an open manner where everyone's going to be at the table, and we're going to do it in smaller sections. That's what the American people want.
Okay. Thank you, Congressman
Hey, thanks very
Bob
much.
Latta.
Thank you.
That is tonight's Talk Back.